Hi everyone, it's Dr. Morrow. I hope you're all doing well, enjoying some of this summer-like weather that we've been having. But with that in mind, I hope you're all still maintaining good physical distancing and maintaining a good, safe lifestyle during these times. I wanted to touch base to update you with where things are at with all of us. We did receive an updated set of guidelines from the Royal College of Dental Surgeons of Ontario last Friday afternoon at 4 o'clock. These guidelines were much anticipated by the dental community and as well very, very disappointing. We were anticipating that we would be given some guidelines allowing us to get back to work and start seeing our patients for routine care. However, this is not the case. The Royal College of Dental Surgeons, in conjunction with Public Health, are still staying firm with their decision not to allow us to go back to work. We are still only allowed to see people or patients for emergency and urgent care procedures. They have extended or broadened this definition slightly. However, as it relates to orthodontics, there really hasn't been very much change. This is very, very frustrating. I know how frustrated many of you are. I've spoken to many of you, and you just want to get your treatment going. And I completely understand. I agree. I sympathize, and I can only tell you, as frustrated as you all are, I am many-fold more frustrated and disappointed. I wish there was more that I could do. However, there really isn't anything I can do other than follow the guidelines that are put in front of us. With this in mind, with these slightly expanded definitions of urgent care, in the next week, 2 weeks to come, I'm hopeful that we will start to be able to fix some of the broken appliances in people's mouths. For example, if you fall into some of these very specific criteria, poking wires, broken brackets that are causing soft tissue irritations, lacerations, cuts to the gums, to the cheeks, bleeding gums, swollen gums, as I mentioned, pain, discomfort, risk of infection, and so on, then I'm hopeful that as I said, in the next week or two, that we can start fixing some of these things for you. However, as I've mentioned, we are not able to yet resume routine care. I'm hoping that this will come soon, but we have no idea when that will be. But thinking ahead, I also want you to be prepared in terms of what to expect as we move forward into this new phase of dentistry. In order to maintain your utmost health and safety of all of our patients and their families, and of our whole York Mills Orthodontics team, some of these systems and protocols in the office will have changed. This is also necessary, of course, to make sure that we are strictly following the guidelines from the Royal College of Dental Surgeons. Some of this will include physical distancing. There will be other things in place in the office that you are not accustomed to. I am including a written explanation of some of these things in this email as well, so please, I would encourage you to read the documentation that I'm including in this email so that you can be brought up to speed with what you can expect in the weeks to come. As things continue to develop and unfold, as we get more information, I will do everything I can to continue to keep all of you updated so that you are in the loop. And I really hope that we can get back to seeing you and providing you with the care that we love to do and helping you all achieve the wonderful, beautiful, healthy smiles. This is what makes me tick. This is what I get excited about. This is what I look forward to, and I just can't wait to get back to work. And I wish I could have started yesterday, last week, last month, but I do need to follow the guidelines that are put in front of us. I thank you all very, very much for your patience, your understanding, and I ask that you continue to be patient with us as we do try to march forward. It's going to be baby steps. We're going to have to prioritize, and we will want to see all of you, and we will see all of you, and we will get to all of you, but it's going to be in a stepwise fashion, and we have to do this in a priority fashion. So I hope you understand and hang in there, but please also know we're here for you and to help you however we can. In the meantime, be well, be safe, and thank you very much for listening again, and until next time, thank you.